I tie the COVID mitigations that we're asking people to take to our core values that we hold in the wildland fire community: duty, respect, and integrity. We have a duty to provide a workforce safe of known hazards to our responders, and they have a duty to keep themselves safe.
We have a duty to take care of our fellow firefighters, really take those precautions, external to the module, within the module, on and off the clock.
They need to respect each other, and wearing a mask is a sign of respect when you're in close proximity with somebody else.
As a matter of fact, all of this runs into respect portion of that equation. Now, wearing the mask protects others from you. It does have some level of protection for yourself.
And you have to have integrity. These precautions aren't just for on the incident, it's for when you're at home, it's for when you're traveling.
The integrity is being able to do that when nobody's watching and being able to build trust within your unit.
We want to have a workforce that is healthy and able to respond this year, and we don't want to be the source of an outbreak within a community we're responding to.
Really, there's been a ton of guidance and emails and direction that have come out, but it boils down to being based off some pretty basic CDC precautions.
Screening is extremely important this year so that we can identify individuals who become symptomatic as soon as possible. The MFAT has developed a wildland fire COVID-19 screening SOP that we've made available on the website that we hope everyone can use. The main intent is to ensure that individuals, supervisors are accountable for ensuring that this screening is taking place.
If someone mobilizes to an incident and they have some of the symptoms of COVID-19, they risk infecting other people, and they also risk coming to an incident and then immediately being demobilized. The supervisors, the home units, there's a couple things that they can do to ensure that mobilization process will go successful. Number one is reinforcing the module of one and keeping track of what the community-wide spread is in your area, and helping to not only enforce the standards for your unit as far as if you're supposed to wear mask wear in public or for your state, but also to make sure that you're modeling the proper behavior. The one thing that we found out was that once the people on the incident started seeing that leadership was taking it seriously and that we were consistent in that messaging, it was easier for them to adopt, because at the end of the day, we're working to keep them safe. And I think that's the message that supervisor at the home unit needs to convey, and they need to anchor into those CDC guidance, which is changing as we learn more about the disease, and make sure that they are following it regardless of their own beliefs.
The issue of testing is an ongoing discussion within the medical and public health advisory team. We're regularly looking at updates and availability of testing, the capacity to test, who should be tested, all of the important pieces to make a recommendation for the interagency wildland fire community. At this time, we do know that testing is a key component to our strategy, and that's why it's so important to ensure that screening is taking place.
Testing can be useful. Testing done wrong can give a false sense of security. It's important for people to know that, and that's why that immediate isolation and the immediate consultation with a medical professional is important.
As the situation with testing changes, we're working closely with the Centers for Disease Control and agency medical officers to update our recommendation and incorporate additional aspects of testing as appropriate.
One of the most effective tools that we have to prevent person-to-person spread is maintaining distancing. That can become a significant challenge on a fire. We're social beings already. We haven't seen a lot of our friends in a long time. We get to come back together with them. During a briefing, you need to be able to hear the information because it's critical to being able to go out and fulfill your task safely. As we think about all those different ways that we're prone to being closer to one another, the key to maintaining social distancing is that awareness, making that a part of the standard and the culture for all the leadership on the fire. And then third, making sure that everyone knows that they have permission, that they have authority from the IC or the agency administrator down to tell someone to back up if they're too close. The way that social distancing is applied in different common activities that we engage in on the fire line is covered well in the Fire Management Board's guidance on fire camps, and then also in the CDC's guidance on the FAQs for wildland firefighters. Some of the ways that can be covered though, or that can be maintained, is if you have to sleep in close proximity to one another, then sleeping head to toe will provide greater distance. Some of the other ways in chow lines is just maintaining that 6 feet away from each other, not going back to an area where other people are likely to come congregate with you while you're eating. So that means going back to your rig to eat your dinner then that's probably a good choice. A key part to think about the social distancing is not only thinking about the actions you take, just thinking how those actions could nudge somebody either to get closer to you or to create kind of an invitational environment that would allow them to get inside that social distancing. And the amount of time someone spends close to you, if they are shedding the virus, is a key contributor to you getting sick from the virus. There's a big difference between you having a quick conversation on the fire line to get clarity on some critical task you're gonna take in close proximity to somebody, and then you spending time sitting across from me, having a conversation while you eat your meal. So understanding that time component of it as well, I think is important to the decisions that you make.
The Module as One approach is a way that we're applying the social distancing strategy within wildland fire. As we bring our teams together, whether that be a crew, an engine module, a finance section, any group, that we be mindful of who we let into that group and try to ensure that the people that we let into those groups are healthy. Once those groups are formed, we want people to stick with that group. And anytime they go outside of that group, that's when they're at their greatest risk. So when we talk about prevention and mitigation strategies such as wearing masks, hand sanitizer, all those pieces, that becomes really important when you're operating outside of your module. We also recommend that we minimize time outside that module. For example, one crew member be sent to pick up food for the whole crew to minimize that potential exposure. When you're outside of that module as one, or it's not feasible, the best thing an individual can do is to try and maintain at least 6 feet of distance. When you can't do that, wear your cloth face covering.
The normal process of getting clear evidence that's publishable in academic journals and everything takes time. You know, it's been about 20 weeks since we've seen this in the United States, and there hasn't been time to gather all of the different components that you would need to be able to do a strong study. However, there are some certain things that we're learning. And I think one of the key things to talk about what's been learned is also to recognize that more learning is ongoing. It's likely that the standards will change. But for now, for us, the standards are pretty simple because unless you're part of a respirator program, you can't wear an N95 mask, or you're not supposed to wear an N95 mask because it's considered a respirator. So then you think about the other options that are available to you, and it's cloth face coverings and it's surgical masks. You know, the mask should be tight-fitting. It should fit around the bridge of your nose so there's not air being expelled up and down.
And it should be worn anytime we cannot maintain at least 6 feet of distance. It is not an expectation that firefighters wear a face mask on the fire line. In the field, there are situations where you can wear a face mask, such as looking at a map on the hood of a truck when we're working in close proximity. But when we're on the line fighting fire, it is not the expectation to wear a face mask. With regard to the N95 mask, an N95 mask is considered respiratory protection, and in wildland fire will likely be limited to medical providers who are part of a respiratory program who have been medically cleared and fit tested. In some cases, if an N95 is available, it could be used to be placed on a sick individual and or somebody who could be COVID positive to prevent the spread of infection.
That mask can protect you in a couple of different ways. The initial information was strictly that it was source protection. That by wearing either a surgical mask or a cloth face mask, what you were doing is you were reducing the distance to which the virus would travel as you talked or if you coughed or sneezed. And by doing that, you were helping to keep other people safe. Some of the new emerging evidence that says that masks can be effective at preventing you from getting the virus. I think if people can work to shift their mindset on masks, look at it in the same way that you would a seatbelt or a fire shelter. Your seatbelt is not 100% effective. Your fire shelter is certainly not 100% effective, but yet those are part of our PPE and part of our culture and part of our standards. And if we can get masks where they fit into that same type of criteria and that's just accepted and adopted, I think it will have a huge benefit on the safety and wellness of the firefighters. You know, hand washing is important. Fortunately, the virus, it's not very tough. And so just regular soap and water hand washing is effective. When you cannot wash your hands, as long as you use a hand sanitizer that's at least 60% alcohol, that is also effective. One thing that is ineffective is if you put the soap or the hand sanitizer in the middle of your hand and you just rub the middle of your hands together. Because when you think about it, the whole intent behind either one of those is to make sure that any of the viruses that are on areas that may get near your mucous membranes, up your nose or in your eye or in your mouth, that you have inactivated the virus. If all you do is rub the middle of your hands and you don't concentrate on your fingertips and then you stick your finger up your nose or in the corner of your mouth or whatever, you still run the potential, albeit much lower than by the respiratory route, of getting that virus into your body. The important thing about hand washing and using the hand sanitizers is to make sure that you concentrate your efforts on the areas that are getting closest to your face. The level to which you need to clean different areas and the level to which you need to be conscious of how things have been cleaned has everything to do with the number of different people that come in contact with that surface. High-touch surfaces, they call them, but those are the ones that if there is going to be viral spread from a surface to a person, that it's most likely to occur. Some of those high-touch surfaces that we encounter often are doorknobs, gas pumps when we go fuel up our vehicles. And so if you think about that, if you think about the areas that most people touch frequently, those are the areas you should be most cautious of and most conscious of when you need to clean your hands afterwards. Regarding the sharing of tools and the sharing of other equipment, the more you can segregate that stuff, it's good practice. It helps to limit the spread. Also, the type of surfaces it is matters. The information out right now is that the virus will live for 72 hours on hard, impermeable surfaces like plastic and 24 hours on cardboard. So just be conscious of that and especially focus your efforts on the cleanliness of those high-touch surfaces.
COVID and coronavirus, all this is just another hazard for our firefighters. We need to deal with it, but we have a lot of other serious hazards out there that we can't lose focus on while we're taking precautions to help prevent the spread of coronavirus within our ranks and to the communities that we serve. So keep that in mind. There's simple precautions. Please take them without even being asked, because that will help everyone out and hopefully everyone will have a safe and productive fire season and accomplish our mission.